However, my experience does not answer the question, should you have a baby? I think I would answer the way a medical student told me. She had just had a baby and she was doing her rotations as a fourth year. She said she did not anticipate how difficult it would be. And that's the truth. She also did not anticipate how her memory would be affected. And that's the truth. She just felt like she had problems with memory after having her baby. And I'm not going to say that that's something that's scientifically proven, but I'll just say that having to deal with a newborn at home, lacking sleep, breastfeeding, while at the same time trying to do the duties of a full-time resident can be extremely taxing on the body. It can induce a lot of stress in you, physical and mental stress. And that physical and mental stress will decrease your performance in whatever thing you're supposed to do at that moment. So the other aspect to think about is, do you have help? And what do I mean by help? Someone who lives in your house, a living nanny, a mother, someone who can allow you some nights to just sleep through the night and take care of the baby for you. If you have that amount of help, it helps tremendously. But if it's just you alone or you with your significant other and they're not taking half of the responsibilities of the baby care as you are, it can be so hard to do all you're supposed to do as a mother and to also give all you can give to your residency program. Okay? Because in residency, when you're there in the hospital, for the majority of your rotations, you're physically doing stuff, looking at patients' labs, histories, or you're scrubbing in surgeries, or you're interviewing patients, or you're moving from location to location. You're studying, your book learning is left to you when you go home. If you have a baby at home when you go home, and you don't have time to do that book learning, or even to do that resting that the rest of your colleagues get to do, then your road is just so much harder. It's just so much harder. Now, when you have a baby as well, you know there's so many unpredictable things. God willing, everything goes smooth. Sometimes, it doesn't go smooth. You can have a complication. You can have life and death situations. You can have a baby born prematurely and have to spend days in the ICU. And you could have a blood clot. So yeah, we just pray and hope that when you have a pregnancy, when you're a pregnant medical student or resident, that your pregnancy and delivery goes smooth. Just anticipate anything can happen, and you pray everything is well, but be prepared. You may have to take a semester off, you may have to take a whole year off and come back again to resume where you left off.